So today we're going to be doing dissection to reveal some of the major vessels of the cat's chest and also the arm. And so we start off by finding the xiphoid process. It should be, you can see where the rib cage is, and along the midline you'll feel an area where the xiphoid is going to end. What you're going to do is take a scissor, some scissors that are fairly sharp, make a small cut into the cavity. You don't want to go deep because you don't want to injure the digestive tract, which we will be looking at a little bit later. And then you're going to reveal the xiphoid process. Once you've done that, you will see where the sternum ends on either side, either lateral side of the midline. And you're going to take a larger pair of scissors, and we have several options. Some of them are curved, some of them are straight, but you want something fairly large. Ideally, you'd have something called a rongier scissor, which is a big kind of plier-like scissor that you can use to cut through bone. And what you're going to do is you're going to start cutting through the ribs on both sides, start moving upwards. If this was a larger animal, this would be fairly difficult, but the cat's ribs are not that tough, so you should be able to crunch through. I will do that, and then we'll come back and we'll look and see what we have once I've exposed the chest. Okay, so I've got the chest exposed. It should be a little bit easier for you because you're going to be starting with a cat that has a lot more of the muscle dissected out. You can see I've exposed the heart. I've taken the rib cage down a little bit. You could actually trim down a little bit farther than I have if you're interested. And you can see that we're starting to see some vessels start to pop up. Now, if we look at the cat, the vessels have been labeled in latex so that if it's in red, it's going to be an artery. If it's in blue, it's going to be a vein. And so you're starting to see some of those, and you notice I've kind of pulled some of the skin off the ribs, and that will help us when we're starting to get into the arm. Again, it should be a little cleaner for you because you've already done some dissections on the arm last semester. I'm starting with a fresh cat for this. And you'll notice I'm starting to see some of the vessels here. I have a lot of gunk up here. This gunk is the lungs. It's a very fragile tissue, so it's often damaged in the process of fixation. What I'm going to do next is I'm going to start kind of clearing a path, right, trying not to cut any arteries, trying to keep everything exposed. And I'm going to start looking at some of the things that are up here in the neck region. I'm also going to clear out some of this gunk that's associated with the lung, and then we can start seeing these vessels a little bit more clearly. All right, I'm starting to clear things up a bit, and as you do this, again, go slowly. And what you're going to do, I've taken a little bit more of the ribs off, cleared a little bit of the lung gunk out, and you can see I'm starting to expose more and more of the vasculature. And what I did is I started up high, and I started removing some of the muscles in the neck, and as you do that, you'll be able to see some of these veins and arteries start to appear. So just cut away the muscle and leave the veins and arteries alone. And then I got to the point where it exposed the trachea, and we see there's some major vessels that are running along the surface of the trachea, because the trachea is part of the mediastinum, and a lot of large vessels are going up and down the mediastinum. So you want to carefully, as you expose the trachea, just slowly work your way back to the heart, and we're going to see more and more vessels appear. And then once you get to the heart, work your way back the other way. We're going to start moving into the cat's left arm, right, forelimb. So, focus your efforts in this direction once you start seeing things appear. And I'll see you in a bit. So here we've got the cat's vascular system mostly revealed. A few things, hopefully yours will be a little bit easier because, again, you have more of the vasculature already cut out. A few things to be aware of. So these are the common carotids. They're probably the easiest thing to sort of find when you're looking in the neck region. This is the trachea. Behind that should be the esophagus. I had a really hard time finding the internal jugular vein, so hopefully yours will be a little bit easier to find. It should run more or less next to the common carotid. The arm, again, a lot of prominent veins and arteries, pretty easy to dissect out. You'll see a lot of white material, right? Actually, you'll see more white material than you'll see arteries or veins. This is the brachial plexus, so a big plexus or network of nerves are going into the arm. And actually this can break a lot. You should never, for example, pick up a child who's under like 5 years old by one arm, because a lot of times you'll actually rip some of these fibers in the plexus and it can be a real problem. That's the cat dissection, and hopefully you guys will have a good time, and I will see you later. Again, yours should be a little bit easier because your cat should have some more dissection.